And of course, the one thing that we're always asked about is reliability and veracity. So I view this as what I call the continuum of exaggeration. At one end, I think there's relatively innocuous, unconscious exaggeration. And at the other end of this continuum is conscious exaggeration. If we're down at the unconscious exaggeration end, this is really where we're talking about is the claimant trying to convince rather than deceive the medical professionals seeing them. And then we move through this much grayer area where patients may be embellishing their story or adding to their story. And ultimately, this leads to possibility of fundamental dishonesty. In my experience, most of the patients I see lie somewhere in between. So fundamental dishonesty certainly does happen, but not hugely often, but certainly I've seen it. Most of the patients are really there trying to convince rather than deceive, and they do tend to embellish their stories. How do we work out a patient's reliability and veracity? Well, certainly inconsistencies are important. And as I've put here, the claimant story versus the medical records. I mean, simple examples are patients that present to us and say, yeah, I've got all this pain is terrible, I can't do this, I can't do that. But then when you go through the records, you'll find, say, a physiotherapy entry saying, Mrs. Bloggs is doing extremely well. She's able to do A, B, and C. She's doing these exercises. This is good. That's good. I've now discharged her from my care, which clearly they're doing well. Alternatively, you may see patients that DNA do not attend, so they've had appointments made, but they never turn up. A one-off is one thing, but when you see it as a consistent pattern of behavior, then you have to ask the question, do you really have a pain issue? Because if you did, you would probably turn up to your appointments. We look at surveillance evidence if it's available. And as I say to all the lawyers, I'm sure you all have some amazing stories about surveillance evidence. Certainly, I've seen some corkers in terms of surveillance evidence, and we could have a lecture just on surveillance evidence. But I would say, as a generality, surveillance evidence is not always that helpful. Generally speaking, the surveillance shows that claimants have a relatively sedentary lifestyle. They're driving around, they're walking around, they're going to the park, they're going to the shops. They're not really involved in anything really strenuous, apart from, of course, when you do see them involved in things like lifting and carrying that they have claimed they can't do. What we're finding from an expert point of view, much more useful, is actually social media evidence. And of course, this is different because the patients are trying to show themselves in a more positive light. And definitely, I've seen a trend where claimants are getting tripped up by their own social media evidence. And I would say that to a certain extent, this is more useful than the surveillance evidence in some cases. And I don't know, but it may be more cost effective to get hold of. And of course, if you believe the claimant was consciously exaggerating during your examination, how would you approach this in the written report? Would you explicitly state that you believe the claimant is consciously exaggerating, or would you tend to be more reserved and point out the inconsistencies and leave that conclusion to the court? That's fascinating because that's almost an identical question that I was asked recently. And my answer is very firmly, my role is to report these things to the court. It's to put them into the medico-legal report. So no, I would not explicitly state that a patient is consciously exaggerating, because you can get yourself into some pretty hot water doing that. However, there's absolutely nothing whatsoever wrong with actually pointing out what those inconsistencies are, and yes, leaving that to the courts to decide ultimately.